You, hey you. Yeah, I'm talking to you. Are you tired of the same old podcasts with the same old panels and the same old rhetoric? So am I. So come spend time with me, where you can have a laugh, be entertained, and learn something. I'm your host, Nova, and welcome to School of Thought. Class is in session. Wow. Welcome. I am Nova Star, and this is School of Thought, and this is a last-minute stream. I'm a little off-centered there. I'm a little bit befuzzled. There's been a lot of things going on. We were supposed to do a financial stream yesterday with my good buddies, Sean Wieland and Bandit. And wouldn't you know, the power went off since I would say noon, and there was no internet until well into the next day, early hours of the morning. Welcome in, Logical Spark. Thank you so much for showing up. This is a last minute stream just to give everybody an update of what is going on. So currently, we are going to postpone that till next Thursday when everybody is available and can get that going on. In the meantime, has everyone been watching Bitcoin? Oh my gosh, we finally broke over $100,000 per Bitcoin, and all of the altcoins have been going off. It's been absolutely wonderful. Are there any Cardano ADAs fans out there? Because my team and I, even though we are not financial investors, okay, we are all invested in that, and we are waiting. We've got them diamond hands, baby, and we're holding that bag, and we're waiting. We are waiting for that payday and that cash out. Go ADA, go. Go Bitcoin, go. Go Trump, go. Let's move this economy forward. Anyways, that'll be next Thursday. We're going to also talk about the basics of finance, what every person should do moving forward on best ways for savings and how to get started and how to invest. The fundamentals that most people don't learn. Schools certainly don't teach it now, do they? And then we're going to get back to streaming as much as we possibly can. Today, we're going to touch on something that I have been dealing with for going on 2 years now. And it is called this wonderful, horrible thing. It's not wonderful at all. I'm just being facetious. I'm being stupid about it, actually. It's really annoying and it's a pain in the ass. It's called lupus. I got diagnosed 2 years ago. Well, going on 2 years ago with lupus. My numbers are low, relatively low compared to most people. I caught it pretty early. And it wasn't actually just a predetermined condition for me. It was actually an environmental issue. I got around a lot of black mold in a house that was over 100 years old and didn't know that there was black mold. And I just come down with some weirdo infection that was affecting my hearing. Matter of fact, I almost lost my hearing on my right side due to it. And it was quite the battle. Nobody knew what the problem was. And then we figured it out. We cleaned it up the best we could. And then I was trying to move out of there as fast as I could about 6 months later during the pandemic. Boy, was that a nightmare. Yes. During the pandemic, when nobody was moving, nobody could find a place. It was very difficult. Anyways, so I'm going to talk an emergency stream, not really an emergency stream, but just a last minute stream so everybody knows why I have not been streaming lately. I caught a bug, but I was actually having a flare up, and it was one of my first, I would probably say, major flare ups. I had a bunch of toxicology tests done. That's the best way I could put it. They have a different technical term for it. But basically to see what all the toxic stuff that I was exposed to, my black mold count was way above the average normal limits, along with BPA plastics and a bunch of other stuff. And I was like, wow, this is pretty weird. My body's not eliminating anything. So I've been on a protocol to eliminate all of that stuff. But in the meantime, I had to move again. I'm now in the Midwest from California. And basically, that bug along with my flare up, sent me into this downward spiral. So if anybody doesn't think that I might have this, which I don't wish this on my worst enemy, I do. And I've been starting taking hydroxychloroquine, which is actually something that they actually use to treat lupus flare-ups, but not much to my chagrin. I've also been on another drug and a protocol, which my doctor, Dr. I don't really want to put names out there just yet. We are working on getting together and doing an interview on the stream, which you'll be seeing a new format on the show for School of Thought starting in January. Some big things are coming. But anyway, she was struggling with that for a long, long time. She was actually dying with it when I met her, and I didn't know. I just kind of knew she looked kind of weird, or not weird, but she just wasn't looking so healthy at the time. And, she was acting a little off. But you don't really want to ask your doctor too many questions about what's going on with them, right? Kind of rude, huh? Anyways, I didn't have any health problems, really, just some stomach issues. I've always been in very good health, and always in very good shape. And basically, I'm doing her protocol, which is not just a complete lifestyle change, because you can actually control a lot of autoimmune disease with that. But I'm also having to do what is called LDN, which is low dose naltrexone. Now, I have a sensitive stomach, kind of affects me a little bit. So if anybody out there actually knows what that is, then good. If not, I will be introducing that shortly. We'll be seeing more things on health also actually to be coming, because I actually want to help people during my travels, and people that I've known. I've come to get into very good contact with a lot of good doctors and a lot of good alternative treatments. So, I want to help people out also. But anyways, I've been doing the LDL and then doing a peptide. And so that put what little money, I'd probably say my numbers were around 800-ish when I first was diagnosed. And then after I started doing the treatment, but I was still being exposed to mold, I got it way down past 300. Well, during the flare-up, for whatever reason, lupus likes to double or triple numbers every time you have a type of a flare-up. So when you start, don't ask me, I don't understand why, but for whatever reason, whatever you started off, it's going to be double by the next time you have that blood test. So I am looking to get those numbers all the way back down. And if I do what she's doing, according to what she is doing, she has no detectable numbers at all. So let's introduce to the stage what lupus is. Wait, let's say hello to everybody in the chat now that we've got people piling in. Hey, Shane. And we've got Romano Productions, and we've got Trippycast, and we've got Logical still in the chat. Thank you so much for joining in. I'm so sorry about yesterday, but more things will be coming, especially as I'm getting better.
All right. Systemic lupus erythematosus. Okay, we totally got this. Systemic is easy and refers to affecting multiple organs in the body. Erythematosus means reddening of the skin. All right. Lupus is Latin for wolf, so affects multiple organs, wolf, reddening of the skin. Not exactly. The modern use of lupus usually refers to a variety of diseases that affect the skin, which was possibly originally used since these diseases resemble a wolf bite on the patient's skin. Is that true? Who knows? At any rate, systemic lupus erythematosus, or SLE, sometimes just lupus, is a disease that's systemic and affects a wide variety of organs, but notably often causes red lesions on the skin. All right, but how does lupus...
Not everybody gets the reddening of the skin. I have not gotten any of that.
...affect all these organs? Well, usually the immune system protects the body's tissues from invaders, but lupus is an autoimmune disease, which means that the immune cells start attacking the tissues they're supposed to protect. With lupus, essentially any tissue or organ can be targeted. And just like a ton of other autoimmune diseases, it's not completely clear why it develops. And like most diseases, it's the result of both genetics and the environment. All right, so let's go over a specific scenario to show how this usually plays out. Let's say that this guy has susceptibility genes that make him susceptible to getting lupus. And he's exposed to UV radiation in sunlight, which we know is an environmental risk factor for lupus. Well, given enough UV rays, think like sunburn, the cell's DNA can become so badly damaged that the cell undergoes
Sunburn or infection, common cold. Yeah, bacteria. There we go.
programmed cell death, or apoptosis, and it dies. This produces these tiny apoptotic bodies and exposes the insides of the cell, including parts of the nucleus, like DNA, histones, and other proteins, to the rest of the body. Well, those susceptibility genes specifically have an effect on this person's immune system, such that their immune cells are more likely to think that these are foreign, or antigens. And since they're from the nucleus, we call them nuclear antigens. And those immune cells try to attack them. Not only that, though, susceptibility genes also cause this person to have less effective clearance, essentially meaning that they aren't as good at getting rid of these apoptotic bodies, and so they end up having more nuclear antigens floating around. This means that B cells might swing by, see them, and start the production of antibodies against these pieces of nucleus, which are called anti-nuclear antibodies. And these guys are present in almost all cases of lupus. All right, so those anti-nuclear antibodies bind.
Shane Nolan says he is right. It's a Latin for wolf, and it looks like a wolf bite, and it does for a lot of patients, which is why I take the peptide and the LDN.
Bind to the nuclear antigens, forming antigen-antibody complexes. These complexes can get into the blood and then drift away and deposit or stick to the vessel wall in all sorts of different organs and tissues, like the kidneys, the skin, the joints, and the heart. Deposited complexes then initiate a local inflammatory reaction, which causes damage through the activation of the complement system, which, after a huge cascade of enzyme activation, leaves cell membranes with channels that let fluid and molecules go in and out all willy-nilly, causing the cell to burst and die. Usually, though, you'd want this to happen to a foreign cell or an infected cell, not healthy cells. When tissues become damaged as a result of these immune complexes, it's known as a type 3 hypersensitivity reaction. UV radiation isn't the only way to damage cells, though, right? It therefore isn't the only trigger that's thought to be associated with lupus. Other
Autoimmune things like lupus are often also triggered by stress, which would also fall under environmental triggers. So, too much stress, oh baby, you're looking to have one.
potential triggers that have been associated with lupus include cigarette smoking, viruses, bacteria, use of certain medications like procainamide, hydralazine, and isoniazid, as well as sex hormones, particularly estrogen, which might be partly why lupus is more common in women, especially considering it's about 10 times more common in women than men during reproductive years, but only about 2 or 3 times more common in childhood or past the age of 65. Okay. As a quick recap, the model that's generally thought to be what leads to the symptoms of lupus starts with some environmental trigger, which damages cells and causes apoptosis.
And black mold with chronic infection from black mold? Yes.
And the release of nuclear antigens. At this point, the genetic components come in, and the person likely has certain genes that make them not so good at clearing these apoptotic bodies and nuclear antigens. So you end up with a lot of nuclear antigens floating around. In combination, they probably also have genes that cause their immune cells to recognize these nuclear antigens as foreign, which initiates an immune response, creates anti-nuclear antibodies that bind to the antigens and then float around and deposit in various tissues, which causes inflammation. These deposits in inflammation,
which then creates disease, right? A nice environment for disease to flourish. Most people with lupus and those types of autoimmune diseases are already poor detoxifiers, which I found out I was one of them. Yes, isn't that lovely? Don't be a poor detoxifier like me. Pay attention to what's going on around you, and do your best to have a clean diet and lifestyle. My God.
inflammation seem to be the cause of most of the symptoms of lupus, which remembers a type 3 hypersensitivity reaction. Many patients, though, also develop antibodies targeting other cells, like red and white blood cells, and molecules like various phospholipids, which can mark them for phagocytosis and destruction, leading to additional symptoms. And this is considered a type 2 hypersensitivity reaction, although it isn't fully understood why some of these antibodies targeting specific cells and molecules develop. So the classic presentation of lupus is fever, joint pain, and a rash in a woman of childbearing age. But the actual diagnosis is difficult because it can affect a variety of people of different genders and ages, and there are also a wide variety of symptoms. There are general symptoms like fever and weight loss, as well as specific symptoms depending on the specific organ system being affected and damaged. In fact, it's so unpredictable that a diagnosis is given only when 4 or more of 11 diagnostic criteria are met. The first few have to do with the skin and often happen to sun exposed.
So prior to me actually getting a diagnosis towards this, I had went to general practitioners that I had known, going, "There's something not right. I'm not feeling very good." Told them what was going on, and they just attributed, "Oh, well, it's just stress. It's just, having a baby. It's doing this. It's doing that." And then they pat you on your head and they tell you to go on your way, and they tell you it's all in your head. Has that ever happened to you? Because it happened to me. To which then I went and I called my other doctor and I said, "Here's what's going on." She goes, "You know what? We're going to check you for something else." She didn't tell me what she was checking me for, though. You know why? Because she didn't want me to freak out, because she knows I will. That's right. I'll freak out. I'll do that.
Areas. The first is a malar rash, meaning a rash over the cheeks that spares the nasolabial folds, sometimes just called a butterfly rash, and this appears after sun exposure. Second is a discoid rash, which are chronic rashes in sun-exposed areas that are plaque-like or form a sort of patchy redness and can scar. Finally, a general photosensitivity of the skin, essentially a catch-all category for other rashes that happen to sun-exposed areas, typically only lasting a couple days. Another type of tissue that can be damaged is the mucosa, which is the inner membrane of various tissues. So the fourth criteria is ulcers in the mucous membrane of the mouth of the nose. Along with the mucosa, lupus can also affect the serosa, which is like the outer membrane of an organ or tissue. So if it gets inflamed, people get serositis, which could manifest as something like pleuritis, which is inflammation of the lining around the lungs and the chest cavity, or as pericarditis, inflammation of the lining of the heart.
Oh my God,
although
this
isn't
scary.
Strictly a criteria, it's worth noting that lupus can affect any layer of the heart, meaning in addition to inflammation of the pericardium, they might also have inflammation of the endocardium and myocardium, leading to endocarditis and myocarditis, of which the former presents as Lippmann-Sachs endocarditis, where vegetations form, which are essentially these clumps of fibrin, a blood clotting protein, and immune cells, around the mitral valve. Next, if the joints get inflamed, patients might also develop arthritis, specifically needing...
Not sounding quite so promising, is it? Jeez.
2 or more joints to meet the criteria. If the kidneys are affected, patients might develop renal disorders, like abnormal amounts of urine protein, or diffuse proliferative glomerulonephritis, inflammation of the glomeruli. For reasons that aren't completely understood, some autoantibodies that target receptors in the brain have been implicated as well. And this can cause neurological disorders like seizures and psychosis. Sort of along the same lines, patients can have autoantibodies against components of the blood, causing various hematologic disorders. For example, they'll get anemia if blood cells are targeted, thrombocytopenia if platelets are targeted, and leukopenia if white blood cells or immune cells are targeted. And that last one's kind of a mind bender because it means that your immune system is attacking your immune system. All right, so the last 2 criteria have to do with specific antibodies being found in the blood. The first one being anti-nuclear antibody, which we already went through. Now, a large proportion of patients with lupus have these, meaning this test is very sensitive. But this test isn't very specific, since these are also seen in other autoimmune diseases. Finally, they can have some other self-directed antibody that is an anti-nuclear antibody, which can be one of 3 types. It could be anti-Smith, which is an antibody against small ribonucleoproteins, or it could be anti-dsDNA, which is against double-stranded DNA, and is often seen more during periods of active disease. And these 2 are relatively specific for lupus.
If you haven't remembered to, please hit the like and the subscribe button and help us out with the algorithms. We've been doing really good when we're able to do a consistent stream, but we've had some knockbacks like moving and getting ill, but we're looking to get back on our feet very shortly.
Third type of antibody, though, is anti-phospholipid antibody, which is actually usually against proteins that are bound to the phospholipids and is less specific for lupus, meaning that it can pop up in other situations. There are three types of antiphospholipid antibodies: anticardiolipin, which can cause a false positive test for syphilis, since anticardiolipin antibodies are also sometimes involved in syphilis. The other two are lupus anticoagulant, also known as lupus antibody, and anti-beta 2 glycoprotein 1. Sometimes, because of these, patients will develop antiphospholipid syndrome, where the antiphospholipid antibodies cause a hypercoagulable state, meaning they're more prone to developing clots and having complications like deep vein thrombosis, hepatic vein thrombosis, and stroke. These patients often end up needing lifelong anticoagulation therapies.
This is getting depressing. I don't want to depress anybody out there. This does not mean that this is going to happen to everybody, especially with proper treatment. Okay, I just want to put that out there.
So lupus is characterized by periods of flare-ups and periods of remittance. So treatment is often aimed at preventing flares or limiting how severe they are when they do happen. To help prevent flares, some patients might have to avoid sunlight exposure with hats or long-sleeve clothes. To reduce severity of flares, corticosteroids might be used to help limit the immune response. And finally, if symptoms are really severe, certain immunosuppressive drugs might be used.
I'm not personally going to be doing autoimmune or immune suppressants personally, but hey, I can't say if it won't work for somebody else.
Thanks for watching. You can help support us.
That was the end of that. So this is just a quick stream today. Just wanted to let everybody know that I haven't been off because I wanted to be. I've legitimately been very, very ill. And there's also side effects from some of these pills, like this new one that I just started taking not very long ago, the hydrochloronique. Oh my goodness, it actually makes you dizzy. So I'm kind of just getting everything going and then feeling my way through. It's been kind of like yesterday I was feeling pretty good and I was ready to rock and roll. And then the power went out. It's actually snowing an hour from me. We might actually get snow tonight. And then the internet has been down and power's been out in different areas around me. So I just want to let everybody know that I haven't forgotten about you. Don't forget about me. We've got lots of great things headed moving forward. And I just want to let everybody know that I have been battling with something. It's very legitimate. It's very depressing. And but I'm endeavoring to persevere. And when it comes to things like that, that's the attitude you got to have. You got to conquer stuff. So I'm going to start getting my doctor over here, and she's going to talk about some things. She's been already texting me about when she's going to have some time off. It'll be sometime probably in the beginning of next year. She's been really busy, and her clinic has been really exploding. So she's been very, very taxed on time. So just hang in with me and I will be back around. Hey, we want to welcome in BT. It's good to see you. If you're new here, I haven't seen you before, remember to like and subscribe. We're going to be doing things on finance. We're going to be doing things on fun interviews. And we're going to do everything from reactions to medical, because I'm actually interested in helping people, because I want to get the word out that there's other ways to treat things than just the regular sawbones general practitioner ways. Which I'm not saying there's anything wrong with it, but I'm just saying there's more out there than that. And now, hey, Daniel Cardenas, nice to see you. Ever had a BBC? No, I can't quite say I have. I haven't had any plastic surgery as of yet. Stay tuned. I might change my mind. You never know. Just kidding. I'm not doing a BBC. Anyways, it's 11:24. I've been streaming a little over 20-something minutes, and this was just a short one to remind everybody that we're still out there. So thank you for joining me tonight, and stay tuned. Remember to like and subscribe. Take care, and everybody, God bless.